We're going to demonstrate the application of a stiff neck hard collar if a patient comes in, presents to your emergency department and is complaining of neck pain or a change in condition and you need to apply the collar. We're going to demonstrate how to do this. These are the Laerdal stiff neck collars that most emergency departments in EHS will have. When you open the collar, it'll come flat like this. As soon as you open it, just take it and roll it so that you can get a nice kind of anatomical shape to the collar. For measuring the collar, you're going to want to have the patient relax their shoulders, and you're going to take fingers and you're going to measure from kind of the trapezius muscle to just below jawline. So in Sybil's case, she's got a longer neck. It's going to be 4 fingers. On the Laerdal stiff neck collar, you have measuring indicators here that allow you to adjust the height of the collar. And so you can pop these off on either side, and you want to make it to heighten the collar to the number of fingers that you had. So in this case, Sybil's going to be a tall measurement on the collar. This can always be adjusted after the fact too if it doesn't fit for whatever reason. You're always going to want to ensure that you have someone holding C-spine when you're applying a collar and maintaining spinal motion restriction. And so what we're going to do now is, while Heather's holding the collar, I'm going to slide the collar gently under Sybil's neck. A good tip is to have the strap folded inwards so that when you get it to the other side, you can just open it like this. Once the collar is centered, the back of the collar is centered under the neck, you're going to take the front of the collar and you're going to apply it in a sweeping motion like this. So sweeping motion down and up. And then you're going to pull the collar and Velcro it here. Once the collar is applied, you want to make sure that there's good alignment between from the mouth down through the collar, down through the umbilicus as well. Bear in mind that if there's a head injury, you want to make sure that you're not attaching the collar too tight so as to impact intracranial pressure. And then once the collar is on and C-spine is controlled with the collar, you can have sandbags or pads or rolls, whatever your site has, placed on either side of the head as a reminder for the patient to not move their neck.